Thank you for joining the Friday Federal COVID-19 updates. I'm Ellen Taverna with the ARC of Massachusetts, and we have two very special guests today with us. We have Lizzie O'Hara, who is the Deputy Chief of Staff for Congressman Richard Neal, and we have Naomi Plasky, who's a Legislative Assistant for Congressman Joseph Kennedy. So thank you both so much for joining us today. We really appreciate it. I know it's crazy on the Hill, so it's great that you're able to be with us. So for those of you that aren't familiar with the ARC, I know many of you are, we are an umbrella organization with 17 chapter affiliates, and our mission is to enhance the lives of people with intellectual and developmental disabilities, including autism, and their families. And we fulfill this mission through advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. So for today's agenda, we're going to be reviewing the disability priorities of the HEROES Act. Again, I know we've done that 2 weeks ago. We had a staffer from Representative McGovern's office, Drea Shropshire, and so we have Naomi and Lizzie here today to kind of go into a little bit more detail of the HEROES Act, and then sort of talk about what's next, and also what their priorities are for their bosses and what they've been working on. And then I'll just talk a bit about our continued advocacy, which is really focused on the Senate now for the HEROES Act, and some additional federal and Massachusetts updates. But as always, with our guests, we open it up for questions after our guests speak. And then if there's time at the end, we'll open it up for any additional questions, or if people want to stay on a little over our half an hour time. But I'm gonna open up for Naomi to chat first and go over some of the provisions of the HEROES Act.
Yeah, well, thanks, Ellen, for hosting this, and thank you, everyone, for coming. So just a really high-level overview of the HEROES Act that was passed in the House, I believe, last week. Everything is blurring together at the moment. But there was robust funding, $1 trillion for state, local, territorial, and tribal governments. There was also $75 billion for contact tracing. It also created an initiative within the CDC to help states build out their contact tracing initiatives so that they can better fit their communities, and it requires the CDC to create guidance and help states and work with other agencies within the federal government to help increase access to these services. Additionally, there was an increased federal Medicaid payment bump. Originally, it was 6.2% for all states, an additional 6.2% for all states above the match that the federal government pays. This would increase it to 14%. An additional, I believe Massachusetts has a match of 50% already, and so this would make it 64% of what the federal government pays for all Medicaid expenditures, which would really help states, one, expand services and access to providers. It's critical right now for people to have access to healthcare services, and robust ones at that. Additionally, there was an FMAP for home and community-based services, which is also very critical at the moment. And then an additional Medicaid provision was last year, Center for Medicaid and Medicare and Medicaid Services issued a rule, MFAR, or the Medicaid Fiscal Accountability Regulation, which is a rule that would alter how states pay for their share of Medicaid, and how they are then able to make payments to providers. As a result, many of those who rely on Medicaid for healthcare services and coverage would see reduced access to care, because states would then essentially be forced to make some budget cuts. MFAR was supposed to go into effect by the end of the year, but HEROES prevents it from going into effect until the end of the COVID emergency. And then I'll kick it off to Lizzie.
Great, thank you so much, Naomi. And also just want to say thank you so much to the ARC. The work you do is so terrific, and Chairman Neal has always been such a big supporter. So we're delighted to be with you today to kind of touch on some things with the HEROES Act and some other things that are of priority for our bosses. Before I go into the stimulus payments and paid leave, I want to go back to the MFAR comment. You don't have to bring the slide back, but just want to reiterate, this is an issue that would have a devastating impact on providers in Massachusetts and around the nation. So Chairman Neal has been very vocal about his concerns with that. So I just wanted to put a plug in for that before we move along here. So the stimulus payments and paid leave. The measure provides additional direct payments with a second round of substantial economic impact payments of $1,200 per family member, and that's up to $6,000 per household. It also would be extended to adult dependents filed on someone else's tax returns, and there would be a second round of payments with most dependents receiving the full $1,200, not just the $500 credit. The paid leave provisions are also expanded to the same leave purposes as paid sick days, with expanded definition of caregiving to include a broad definition of family members caring for an adult with a disability, which includes siblings and grandparents. From the workforce perspective, it also provides $850 million in child and adults with disabilities care, also known as family care funding, for essential personnel, including DSPs. I want to make a comment here. Chairman Neal worked very hard to include this language in the HEROES Act. And we have my colleagues at the Ways and Means Committee who are working behind the scenes to ensure this moves forward. So we worked really hard with the chairman to include this. Also includes the DSP workforce and the essential workforce for funding for hazard pay and overtime. From the healthcare perspective, does a couple of really big things. It provides for a 2-month open enrollment period, allowing individuals who are uninsured for whatever reason to enroll in coverage. Currently, folks can only enroll in the ACA plan during open enrollment period or because of a qualifying life event if they were previously insured. Chairman Neal's worked really closely with HHS, expressing his concern about this, have encouraged them to have an open enrollment period. So that is something that the chairman continues to push for. It also eliminates, HEROES Act also eliminates cost sharing for Medicaid beneficiaries, Medicare Parts A and B, and group and individual health plans for COVID-19 treatment and vaccines during the COVID-19 public health emergency.
For housing and transportation, there's a number of provisions that would prevent evictions up to 12 months, $100 billion for emergency rental assistance. There's $11.5 billion for emergency solution grants to protect people who are experiencing homelessness. There's also $200 million for supportive housing for people with disabilities, $4 billion for tenant-based vouchers, $100 billion of which is for new vouchers, and $750 million for project-based rental assistance. Congressman Kennedy has been very vocal about the need to ensure that as unemployment increases, that people do not experience homelessness at this time, and all of these together will really support ensuring that people are able to stay safe and healthy in their homes. Additionally, it provides $15.75 billion in emergency operating support for public transportation, and also includes a requirement that state Medicaid programs cover non-emergency medical transportation. For education, HEROES provides $100 billion in support for educational needs for states and school districts in higher education, and requires states to include assurances when accepting funds that all students with disabilities are able are afforded their full rights under IDEA. And $1.5 billion for broadband access to close the homework gap, and $4 billion for emergency home connectivity needs, and small increase in Assisted Technology Act program. Additionally, all of those technology provisions will help people receive telehealth services as well.
For disability rights, it provides standards for absentee ballots cast by mail and ensures that the absentee ballots and related voting material are accessible to voters with disabilities. That's also a really big issue for Chairman Neal. Requires the CDC to establish field studies to better understand the health inequities that are not currently tracked by the Secretary of HHS, and provides funding to modernize data collection methods to include collection on disability disparities, among other issues. And I also would like to take this moment to touch on a couple of other things. Ellen, is there another slide after this, or is this a good point? Okay. Just want to touch on a couple of other things that would be of interest to folks, is how important everything is here, but also want to talk about some other things that Chairman Neal found really important that directly impact you, is expanding the earned income tax credit and the child tax credit. That is a huge priority for him. That is included here, but we will continue to make that a high priority. In addition, Chairman Neal made sure that all Social Security and SSI beneficiaries are eligible for the economic impact payments. And because before that, it was just seniors that were have access to that. So I wanted to make sure that folks are aware of that. In addition, from the health perspective, the Ways and Means Committee hosted the first ever virtual hearing in Congress this week, and it focused on inequities in the healthcare world. And it was something that was really very moving, and it was really interesting. We had an excellent group of witnesses, but wanted to make sure if folks hadn't seen that yet, I encourage you to go to the website, the Ways and Means Committee, and take a look. It was really insightful. Other issues in the health department that would be of interest to you all is Chairman Neal has written a letter to AZAR regarding the limited English proficiency, and also included sign language in that. And I'm happy to share that with you, Ellen, so you can share with your folks as well. Right. In addition, he continues to work to make sure that nursing homes are safe. There's been a lot of work around that, especially now in the COVID-19 era. And obviously ongoing need to address high drug costs, and also to expand ACA coverage. So those are things that are of importance to the chairman. Other thing I wanted to flag for folks is yesterday the House passed a bipartisan PPP Flexibility Act, the Paycheck Protection Program. And Ellen, I'm happy to share information with you as well on that, so you can share with your folks.
Great.
And then let's see what else. Oh, I wanted to get your thoughts on something, and we don't have to answer this now, but we're noticing lower levels of applications for SSI and SSDI right now, and that's probably connected to the lack of in-person services. And we wanted to, and this is from the committee side of things, see, how can we be helpful there? That has a direct impact on your members. And as folks are going through that, would love your insight on that. And the other thing is looking at funding for hospitals and other providers, continue to work towards ensuring that they get the funding they need. A lot of hospitals and providers are hurting right now, and that has a direct impact on everybody, but particularly the ARC and your members. So that's continues to be a high priority. And before I take up all the airtime, want to make sure that Naomi gets some time here as well.
Thank you, Lizzie. Congressman Kennedy has also been very supportive of all of Chairman Neal's efforts in all of the things Lizzie just mentioned, but to pull out a couple of the things that are priorities that he's been pushing, HEROES also included $3 billion for Substance Abuse and Mental Health Services Administration, an additional $3 billion. We have seen increased demand for mental and behavioral health services as people are self-isolating and self-quarantining, and making sure that everyone is staying safe and healthy, both physically and mentally, is very important to the congressman. Additionally, he has very much advocated to expand Medicaid and Medicare. He has introduced a Medicare Crisis Program Act, which not only expands access to Medicare for those who are unemployed, but would also expand coverage for Medicaid and CHIP programs for those who are uninsured as well, by increasing the federal poverty limit to be eligible for new enrollees, and also increasing the federal match to states for these new enrollees as well. And for nursing homes, has been an issue across the states, particularly in Massachusetts, and soldiers' homes as well. The congressman actually today unveiled, or yesterday actually unveiled a plan for both that would increase reporting requirements, increase prevention control, and oversight for both of these facilities. We need to address what is going on with coronavirus at the moment, but also ensure that this does not happen again. If there is a second wave of COVID, or if there are other public health emergencies, we need to ensure that people in long-term care facilities are able to remain safe and healthy. And then additionally, the congressman has been pretty outspoken about the Massachusetts ventilator guidance, about how it would impact those with racial and ethnic minorities, as well as those who are those with disabilities, and those with mental and behavioral health conditions as well. And he continues to advocate for those issues as well.
Great. Thank you so much. And thank you to Congressman Neal and Congressman Kennedy for all of their efforts and supporting the disability community. And thank you both for all of your great work. So I just wanted to answer your question, Lizzie. I hadn't heard that about SSI and SSDI recipients, that there were problems with whether or not they could access, in-person services or couldn't, and that impacted application level. So I will check on that, or check in with our community and our social media and maybe the state webinars that we have on Thursday, and see if people are experiencing that. So, and I'll get back to you. Okay. I want to open it up for questions. Let's see.
Oh, and Ellen, real quick, going back to the next step to the HEROES Act. That is, if I had an answer to that, I would be a millionaire. That's, I think folks are trying to figure out next steps with that. There's a lot of support for the measure, that's for sure. The Senate's back in next week. I have not heard whether or not they're going to take it up. Unlikely. Okay. And this is, I've been hearing a lot of leadership referring to it as a almost like a placeholder, if you will, kind of a jumping off point to put together another round of legislation. But as that becomes clearer, we will certainly keep you in the loop on what's happening, so there's opportunities. And Naomi, if you have any insight on that as well, welcome to hear that too.
No, pretty much the same thing. Passed out of the House and is now sitting in the Senate, but I've also heard that likely they will not be taking it up, but is the negotiating point. Is where they can start. So,
yeah. So continue to advocate in the Senate. Yeah. That is a very good piece of advice.
Yeah, thank you. We're definitely doing that. And we're always encouraging our members and constituents to talk to their family members out of Massachusetts, because we know that Senator Warren and Senator Markey are both very supportive of our issues. So, we need to get the word out to all senators. So I see there's a question in the chat box from Nancy Farnsworth in regards to adult dependents potential $500 reimbursements in the second stimulus check, what happens for divorced parents who claim adult child opposite years?
So Nancy, thanks for your question. I would love to chat with you about this offline. One of my colleagues worked on this language and is in the weeds more on it than I am. So Ellen, if you can connect Nancy and me afterwards, that would be terrific. And then with the answer, share it with your group, because the whole point, Nancy, reached out to everybody, because the answer could be beneficial to more people as well.
But it is, I mean, at least for the heroes, I think the Divorced Parents Act is it's a trickier issue, but for, for people that are claiming adults as dependents, they're now going to receive their stimulus payments, because that was an impediment for SSI,
right?
SSDI recipients. They weren't getting any funding from this, as a stimulus payment at all, because they were claimed as a dependent. But that's no longer the case in the HEROES Act if it goes through the Senate. Right. But you're right, the divorced parents, how that changes things, I don't know. If have both claimed separately. So that, yeah, you're right. That's a little more nuanced.
Right. And Ellen, at the end, I believe you have our email addresses. So
yes. We'll get you in touch with.
That'll be great. Thanks, Nancy.
And then others, if you want to just chat in the chat box, or if you want to unmute yourselves and ask a question, please go ahead. Oh, okay. We have Beth. Interested in your opinions. Might we see more interest in the Senate as we get closer to the November election? Oh.
More interest in the Senate version of the HEROES Act. I think we're going to see a lot of interest in a lot of things that have direct impact on voters as we get closer to the election. A lot of people are in a bad place right now and they need help. So I think we're going to see more interest in the HEROES Act, but also that you take the HEROES Act and break it up into different pieces. I think you'll see different people needing help in different arenas. So I think the bottom line is, I think, yes, and even before the election as well, before November, like in the summer. Naomi, any other thoughts on that?
Yeah, I mean, I think within the next few weeks, month and a half, we'll be seeing another bill pass. And so I think now, like Lizzie mentioned before, is the time to advocate for the issues that are important to you. These things are right now, I think, must passes because we know that people are struggling and we need to ensure that we address the issues that people are facing on a daily basis. So I think, like Lizzie said, of course, around the election time, there will be more of an interest to help constituents, the people who are voting for these members, but then also before that as well.
Okay, we have a question, comment from Christine Hubbard. Thank you so much for the work that you do. I think this pandemic has demonstrated that it is essential that those providing long-term services and supports are treated as essential workers and an integral part of the healthcare system, and therefore not overlooked for PPE, etc. And that is a part of the HEROES Act. So you're right, Christine, absolutely. Thank you for your comment.
Yeah, and it's so important. PPE is a lifeline for frontline folks. So your comment is taken to heart.
Yep, absolutely. And I know like Congressman Kennedy is on the phone daily tracking down PPE for providers to ensure that they are able to stay safe, and those also in long-term care facilities as well.
Yeah. And we worked closely with HHS. Chairman Neal reached out to the secretary early because the national stockpile, things were not getting to the state. So it was, we were just supporting the Massachusetts frontline workers to ensure that they had the PPE they needed.
Great. Do we have any additional questions? All right, well, hopefully if we have time at the end, we can open it up for questions again.
Okay.
I'm just gonna go over a few other items. I know many of you have seen this slide before, but I just want to remember that we have our continued We Are Essential campaign going on, and to please use the ARC's story collection tool, which is a really great resource to collect and share stories and send to your members of Congress. And then, of course, we have sample tweets and messages to use for the We Are Essential campaign on social media, and the action alerts that you can use to either call, email, or tweet, particularly your senators, which is the most important thing right now. And then I just want to let everyone know, as you know, the ARC is a bipartisan organization, but we wanted to update you on a development that the Democratic presidential nominee, Joe Biden, has released his plan, overall, his long-term plan for the participation and quality of people with disabilities, and then also a plan to support people with disabilities during the COVID-19 pandemic. So I just wanted to make sure that you all were aware of it. If you wanted to check it out, I think it's important to keep updated on what the presidential nominees are doing, which is really just Biden and Trump right now, but to understand what they're looking at as far as our community. And then there was an update that I just saw right before the call today. I put this in, so I haven't looked at the guidance yet, but I just want to let you know that the CDC has released guidance on COVID-19 that relates to individuals with disabilities. And so there's guidance for direct service providers, guidance for group homes for individuals with disabilities, guidance for direct support providers, caregivers, parents, and people with developmental and behavioral disorders. And so I think it's worth checking out. I know we're working very closely with our state agencies as far as moving forward into phase 2 and how we're opening up different programs like our day and employment programs, residential programs. And so it's good to see this CDC guidance as well as we work with the state agencies to provide guidance as well. And then related to that issue, I just wanted people to know that congregate care settings data was released in the Massachusetts state government website on the COVID-19 daily dashboard. So these updates are going to happen every Wednesday, and it shares cases and client deaths in large facilities operated by Health and Human Services, also smaller congregate settings, including group homes, which is something I know many of you have been advocating for to see. And so that is all public data now. It also reviews the testing programs of nursing homes, rest homes, and assisted living sites. And this was part of legislation that passed the House and Senate yesterday. And then it was also released. So it sort of all happened at the same time. So part of that bill is mandating and making sure that we're getting this data and it's public. And then it also creates a task force that's supposed to develop a report by the end of June on issues that are impacting underserved populations, including the disability community that would require further study. So this has now moved on to the governor, so that passed yesterday. So thank you all for your advocacy. I know that AFAM was working hard with an action alert on this issue. So it's great that this is all now public data. And then of course, I always give a census update every week. And Massachusetts self-response rate is at 62.4%. We're still ranked 20th. And that 62.4 is compared to the national average, which is 60.3. And I wanted to let you all know that we have a new contact number for our Census Questionnaire Assistance Center. Herb Cabral will no longer be our contact for this. It's Kathleen Amaral, and this is the information for her with the same census email, census@arcmass.org, but a new phone number. So we just wanted you all to be aware of that in case you do have questions on the census. And just to keep the momentum going, if you see any posts on social media that we put up about the census, please continue to share. There's still many hard to count parts of Massachusetts that haven't responded to the census, and as you know, it's really important now more than ever. So just keep the momentum going. We appreciate all your advocacy around that. And that's it. So I have the contact information for Lizzie and Naomi. But if you have any additional questions you want to ask right now, otherwise you have their email addresses if you want to follow up with Naomi or Lizzie.
Yep. And one thing with my email address is make sure you use the apostrophe.
Oh,
that's very important.
Yeah. Good to know. Great. Thank you. Also, we have a comment from Donna. Lizzie, Naomi, and Ellen, thank you for all your time and help. These slides are helpful for me in communicating with my legislators. That's great. Thank you, Donna.
Thanks, Donna.
All right, well, we're right on time. So if we don't have additional questions, you can say goodbye. You can enjoy a lovely Friday. It's very nice out. So again, thank you so much to Naomi and Lizzie. I really appreciate you coming on, and we'll definitely keep in touch and keep updated. If you guys have any information you want to share and I can share with the group, please let me know. But I really appreciate you taking the time out of your busy schedules to join us today. So.
Oh, happy to join you. Thanks for hosting us.
Yes, thank you for having us.
All right, great. Thanks, everyone.
Have a good weekend. Bye-bye.
All right, bye.